This will close within 2 hours of birth. Sometimes it'll take days. Sometimes my friend Herb Cohen up in Boston, who's been practicing all through the 1970s with pigs, keeping the pigs alive, would come up through an arterial system and come all the way up and fix this in the baby. So his work with babies' hearts. So this, we now have a procedure through many years of practice in fixing this difficulty right here. Okay, now the blood is inside and it's going to press on into the muscular part of that right side of the heart, the ventricle. This little valve that we have to go through to get to the ventricle is going to have 3 septums. There's 3 septums here. There's the little strings of that hold it down. There's the special muscles. These are called these are called the septal parts of the right AV valve with the tricuspid. So 3 septa, tricuspid, right AV valve. And I should make a note, just like the other side, it's the first heart sound. So this is love. All right, so we have, remember over here we have love and then dove. 4 valves, only 2 heart sounds. So all of the blood from above goes down. All of the blood from below goes up. Love, dove. If this valve is incompetent, or either of these valves are incompetent, then the love becomes elongated into a love, dove. Love, dove. Okay? Why are there strings here? The strings are to prevent the incompetence of the valve. So that it doesn't open or close the valve. Remember, the blood does that. The blood opens the valve when there's pressure. The blood closes the valve when all the blood fills the volume here. And then the contraction of the muscle closes the valve and sends the blood into the next area of the heart. Or in this case, going to be the large vessel. Okay? So we're going to close the valve. The reason we have strings here and the special muscles, these are the chordae tendineae, these are the papillary muscles. The reason that they're there is so that when the valves close nice and watertight, they stay in their correct position. They're emmetropic, right? And so that means that there's no reflux. If there's injury to those tissues right here because of a respiratory burst, then there could be a reflux and there could be a heart murmur. So there's 3 areas for heart murmurs. There's an area with the first heart sound, there's an area in the vicinity of the second heart sound, and then there's an area that has nothing to do with heart sound, where there could be murmurs. Okay? So that's the first heart sound and the valve. We come through, there's going to be, notice there's a lot of trabeculocardiae here. And so there's not so much up here of the rough area of the heart. The rough area of the heart is the more ancient heart, the first part, the young part of the heart to form. We had 12 aortas because we were sort of going to our fish state at that point. Remember, we were like little worms, little earthworms, and then we became fish. Didn't do us much good to have gills, but we had them anyway just to try it out. And then we came along and we had the 12 aortas, and we used the aortas basically to make all the rest of the smooth structure here. Okay, so this contractile structure is the first part to form, and it's a very rough area. This is called pectinate muscle. It just means rough area. And there's a little bit of it in the right auricle. Virtually absent from this chamber, the left atrium.